My legs get fatigued and tired when I stand for a long period of time or when I walk. What could be the cause? Now, the cause for fatigue of the legs or the lower extremities or weakness of the lower extremities could be multiple causes. It could be a muscle problem, a peripheral nerve problem, it could be a spinal cord problem or a brain problem. We begin with the peripheral nerves. If you have peripheral neuropathy, especially if the peripheral neuropathy is affecting the motor nerves, the nerves that are responsible for the movement of the muscles, that can cause fatigue and it can cause weakness of the lower extremities without pain or numbness or tingling sensation. It could be also a disc pushing on a nerve root. It could be in the lower back, middle back, or it could be in the neck that can cause also weakness without causing pain or numbness or tingling sensation. Also, it could be a muscle problem. If you have myopathy or if you have muscular dystrophy, that can cause weakness of the lower extremities, specifically the proximal muscles, without causing pain. It could be a problem with the spinal cord. If you have transverse myelitis, which is the inflammation of the spinal cord, or if you have any mass pushing on the spinal cord, or if you have a disc pushing on the spinal cord, or if you have multiple sclerosis affecting the spinal cord, that can cause fatigueness and muscle weakness in the lower extremities. And finally, it could be a brain problem. MS or multiple sclerosis can cause the problem if you have a mass pushing on the area of the brain responsible and controls the legs. That can cause also leg weakness. The bottom line, if you have fatigue of the lower extremities or weakness when you stand for a long period of time or when you walk, you should see a neurologist. It begins with the neurologic examination. Based on that, the neurologist will determine where the problem is, that it could be a muscle, peripheral nerve, spinal cord, or a brain, and based on that, they will order the specific test to confirm the diagnosis. Based on the diagnosis, we treat the patient. Thank you.